created in addressing this issue so that actionable change can actually happen. So I'll end there. Happy to answer any questions as the format allows. And thank you again for having us.
Sorry, did you have any priority countries, Jennifer?
I did mention we have about 25 priority countries. I can name them if you want. I have them in front of me, but it is a bit of a list to get through.
Okay, no problem. Thank you. Thank you very much. All right, so now we're going to move to GIZ, to Ernesto Lemke, please. Lemke, thank you.
Yeah, thank you for pronouncing my last name right. It's sometimes difficult. Yeah, so let me touch base on what we discussed so far in the last 2 days. I mean, we heard how data governance is an approach to address privacy, ownership, sharing, and access to good data governance, which can maximize health through our use of data while safeguarding individual rights. And in regard to effective partner collaboration, I think we have here a good platform, and unfortunately not all the countries could engage here in person. So I think for the future, it would be good to have regional meetings in partner countries to really ensure in-person participation of delegates who are now joined in online. Regarding to aligning partner priorities with country priorities, I just wanted to state that GIZ and also through the newly established Team Europe initiative, Digital Health, where GIZ is engaged, there we align, or we are now planning to align regionally with the Africa CDC. And also that being said, we assess that for the strategy to be successful, we really need to strengthen the institutional capacity of countries. So this strategy can also be fruitful in the region. And this we plan to support through our bilateral programs or programs in Cameroon and Togo, and our regional programs through our also newly established regional program on the One Health Data Alliance in Africa, and also in our regional program that is supporting currently the Africa CDC, which is based in Addis. Regarding the attraction of investment for country health information systems, we are in the donor constituency have deeply acknowledged the value of strengthening HIS, and our investments reflected priority and will continue to do so, particularly in the light of our approach to pandemic response and preparedness. But we have to bear in mind, health information systems need a long-time commitment, which goes further than our 3-year project cycles that we have. And for that, we really need new innovative approaches that include private sector academia and strengthen academia of countries. What we also are doing within GIZ, supporting the health informatics network in Africa called Helena. And what we also heard and saw during the last couple of days, the political will within countries is very important for this. And for that, and this was mentioned also this morning, we have to increase the sensitivity what the health information system can do and what the added value is. And basically, we know it in this room that it's a backbone of public health planning, but we need to enhance the technical understanding of decision makers to really increase the political will. And with that, I end my input. Thank you.
Thank you so much. So now we're going to move to Gavi, the Vaccine Alliance. We have Heidi Reynolds here, Senior Specialist Evaluation and Learning.
Good afternoon, everybody. I'm Heidi Reynolds with Gavi. It's a pleasure to be here with you this afternoon. I've been following along online as well. Gavi, as a vaccine alliance, is in a unique position to guide and support data investments for national immunization programs, including digital health information systems. The role is also an entry point for coordinated investments in primary healthcare. Gavi supports countries in developing tailored national digital health information for immunization roadmaps that complement existing policies. Gavi supports data investments that are tailored to each country's specific context and maturity levels, specifically data systems to identify and reach missed children who've never had immunization, and marginalized communities. This includes investments such as using mapping and geospatial technologies, strengthen partnerships with private sector and NGOs who have reached into conflict zones or refugee populations, or work with mobile populations. Gavi also recognizes the importance of gender intentional lens to planning, implementing, including gender analyses and monitoring the implementation of data investments. Gavi also encourages building on the COVID-19 innovations, such as platforms that improved supply chain tracking and surveillance for vaccine preventable diseases. And the Alliance will continue to strengthen collaboration and data sharing between countries, partners, and international organizations. Gavi supports a unified Alliance vision for data investments and a focus on end-to-end support. This includes investing in human resources and in creating an enabling environment for data investments and promoting data governance. Gavi has specifically directed to stop activities that create silos and duplication and that focus only on pilot projects. During the 5.0 strategic period, the monitoring and learning processes for Gavi have been streamlined, working to support monitoring those indicators with existing data sources and working with WHO and UNICEF processes to revise and update the joint reporting forms, but also encouraging a more focused and targeted lens on learning that is tailored to country-specific questions. For Gavi, the full portfolio planning process, or FPP, is when the applications are designed by countries and submitted to Gavi for support. That and the annual joint appraisal processes are specific opportunities for engagement and alignment. The FPP process is an important opportunity because in 2023, there are 41 countries that are undergoing this process, and 21 of those countries overlap with the Health Data Collaborative countries. Finally, Gavi is a data-driven learning organization that underscores the importance of learning processes and evidence generation that can help inform how governments and donors plan for and allocate funding to tailor investments to the context. We need to improve the evidence of cost-effective approaches using rigorous designs that account for systems complexity. The monitoring, evaluation, and learning plan for Gavi's digital health investment, which is led by Health Enabled, and the zero-dose learning hubs implemented by several organizations during the strategic period will contribute to building this evidence base. Thank you.
Thank you very much. So we heard a lot during this meeting about how there's issues with donors and multilaterals and others not listening to the countries or aligning. So it might be good if when you're answering, if you could also please include what you're planning to align with country plans and to collaborate with each other when investing in government systems. Right, so next we're going online to the Global Finance Facility, Malatela Tuane, who's the senior expert on civil registration and vital statistics. Malatela?
Hello, thank you very much for having us. Can you hear me well?
Yes, yes, yes.
Okay. No, thank you very much. And I'll just quickly go on what the Global Financing Facility for Women, Children and Adolescents does. So already from the point of our advantage is that already we are a multi-stakeholder global partnership that is committed to ensuring that all women and children and adolescents can survive and thrive. We currently support 36 low and lower middle income countries. And when I was looking at the priority list, we are in 60, I think we overlap in 16 countries. So we provide catalytic financing and technical assistance to develop and implement prioritized national health plans to scale up access to affordable quality care for women, children, and adolescents. The GFF has pioneered a shift from traditional development approaches to a more sustainable way forward where countries actually lead. And this resonates very much with what Mayor Onalenna was talking about in terms of aligning with country priorities, the country leadership, as well as single M&E framework. That's the approach that the GFF takes. We bring together global partners to support a prioritized, costed national plan. And through this partnership, the GFF aims to mobilize additional funding through a combination of grants from the GFF Trust Fund, financing from IDA and IBRD. These are the these are the loans that countries can take from the World Bank that are matched with the funding from the GFF Trust Fund. And one of the GFF strategic objectives is focused on sustaining a relentless focus on implementation and results. Therefore, core to our agenda is a data-driven approach that enables routine monitoring of available resources and the implementation of the prioritized reforms. And maybe just to highlight that our support from the data and particularly on health systems, we are focused on improving the HMIS, the civil registration vital statistics system. We have support for MPDSR, but we also have a dedicated support aimed at monitoring and action for gender and equity. And we do this through supporting countries to have those priority areas through supporting country platforms where data reviews, support for data use is provided. So we also provide support for capacity building, competence-based training. I think I'll end here, and if there are further questions, we'll be happy to answer. Thank you.
Thank you very much. Now we're moving to the Global Fund to Fight AIDS, TB and Malaria, Mark Landry, who's the Senior Specialist, Country Digital Health Information Systems.
Great, thanks, Sam. Really a pleasure to be here. Such an incredible learning, particularly from the countries. I think your voice is really most important, and frankly, for me, all that matters. We just want to mirror back and provide more joined up support. So a few points to acknowledge. I appreciate the colleague from Botswana sharing kind of a summary of some of the shared priorities. We spent a lot of time framing issues, and I hope we can walk away from this meeting talking about what we're going to do next. So I'll share some of the commonalities I see in what we're thinking in terms of our comparative advantage. Well, first I want to connect on those points. So these areas around leadership and governance, the HIS resources from a standpoint of infrastructure, systems, technologies, et cetera, super critical. That's another priority. We have actually taken that one step further. That's very much applying more architectural approaches, which look at the data, the systems, the technologies, as well as the applications. So taking these health information or digital health strategies and thinking about a more joined up architectural approach to improve the data sharing, interoperability, et cetera. So that is spot on. And then I think fundamentally, and just at lunch, having more discussions with a colleague from GIZ around the importance of capacity development in the HR. So I think those are right in our sweet spot for shared priorities. We have been trying to analyze what have been our investments. So we fund over 100 countries on 3-year grant-making cycles, and that comes out to be close to $100 million per year, as well as Secretariat funding resources as well. So it's quite significant. And at the end of the day, we want to apply everything we've been talking about the last 2 days, how to make these more sustainable, scalable, longer-term approaches, and not just digital data silos for programmatic uses. So when we talk about tools like SCORE, I think it's great for assessment, but how can that or other instruments be used by you and countries to monitor the performance of your health information system across multiple dimensions, such as the SCORE or other tools? I think that's a valuable way to message to donors and development partners where you are, what your priorities are, when you can benchmark against a standard tool like SCORE or the Global Digital Health Monitor or others that are out there. But I think from a prioritization standpoint, we do have a number of countries, 20 or so, that we are prioritizing for more intensive support around these pillars, the same that you described, leadership and governance, architecture, standardization, interoperability, and capacity development. And I'm happy to share that. But the last thing I want to say is just a reflection from a recent meeting in Malawi, where actually a number of the development partners that were coming for a global event sat with the Ministry of Health and with the ground partners, actually basically tried to have a country HDC kind of discussion, right? And so where we are talking about very specifically now, having these discussions globally is one thing, but when you go into the country, you know, what are you sharing about the optics and visibility to specific investments, periods of performance, constraints around those investments? What are the domesticated plans for creating civil servant slots by the government? How can partners support interim approaches? You know, how can these be complementary, redundant? And so I would just suggest as one action point for all of us in this HDC community is translating this very, very effective approach and practice, which I think the HDC does work intensively in several countries, but really making that you know, more effective than it is now by the learnings that we're hearing from these past 2 days, because I think the governance aspect is the most critical starting point. So I think we need to start there with the leadership and governance and supporting countries with that. And everything else, in my view, is an outgrowth of where once that can be supported most effectively. Looking forward to aligning and sharing our countries with what others are doing in your priority countries, and then bringing that to bear country by country, where we can optimize these investments and help countries do more with less. Thanks.
Thank you. Now we're moving online to Norway, to NORAD, to Tina Larsen, who's the Senior Advisor, Department for Human Development Section of Global Health. And please also, can you all comment on how you plan to do your alignment as well with what we've been hearing today? Thank you so much. Go ahead.
Thank you, Samantha. First, just to say, yeah, hi from Oslo. Sorry, couldn't join the chateau. But I've been following this almost 2 days now online, and it's been very interesting seeing all the reflections and different perspectives, the different presentations, and especially, of course, the country examples and the experiences shared from the country, which is the most important. And yeah, very useful to hear both what is working and what is not working. And I guess, unfortunately, hearing that a lot of the challenges are not new. South Sudan first, I think, brought up the issue of fragmentation, and I think that we can say from NORAD as well that we have contributed to this by supporting the C-specific programs and initiatives, and this is when we're talking about how we can contribute now, or what our role is. We are shifting more towards looking at health system strengthening instead of looking at the C-specific programs, and with that we see health information systems as a very crucial part to this, and health system strengthening and health information systems being led by the countries. Also within this, we think primary healthcare is an important area to focus on. I'm happy this came up a bit more today. Would be happy to see this discussed a bit more, and how we're including the primary healthcare, the community levels, and civil society more in these discussions. I think I want to echo the Global Fund saying that it's very good that we're having these discussions, that we are agreeing globally now on specific frameworks, and that we are agreeing on collaboration. But it's important that this is trickling down to country level that is being led by the ministries, but also trickling down to community level. So I think it's been interesting also seeing the discussions about different data sources going into HIS. We're not just talking about data from clinics. For us, we are supporting different areas, academia, multilateral agencies and civil society, and hopefully with this we can contribute and have discussions about a more horizontal approach, health system strengthening related to health information systems, and hopefully create linkages between our different partners at country level. So yeah, a lot of the multilateral agencies are here, which we are happy about, and then it would be nice to see more of the civil society also being actually involved in the discussions. About SCORE, this is also something we hope can be a tool to help identify gaps from the country. So it has to be. It's important that this is something that is seen useful for the countries and to identify gaps, and hopefully it could be a starting place for us as donors and partners to support needs from the countries, and then that we can be more flexible in responding to this. Also, I think it was also brought up funding periods. This is also something we want to be better at, having fewer partners, but supporting over longer periods, and that we are also patient in terms of results and focusing on systems that are sustainable and that will grow better over time instead of just new initiatives. On country priorities, we also don't have specific country priorities, but I would just, close then by saying, despite this, we do think it's important that initiatives are coming from the country level, and then we are supporting a lot of multilateral agencies to hopefully reach more countries. Thank you.
Thank you, Norad. We're now moving to SDG3 Global Action Plan Secretariat. Hendrik, over to you.
Thanks, yeah, and you already heard me, so I'll keep it very short. But I think that many of the presentations which came up now highlight this aspect, that there's a lot of offer of support, but I think the key question which we can maybe explore a bit further is how do we bring that support together behind one national plan which is costed, and so that the investments really align to what the national priorities.
Thank you. That was very short and sweet. Very good. So now we're going to Transform Health. Matilda Forsland, who's the Executive Director. Is she in the room?
Yeah, I'm here.
Oh, sorry, great. Go ahead.
So yeah, in terms of our added value, so Transform Health is a coalition of 130 organizations advocating for digital transformation and health data governance to achieve universal health coverage by 2030. So I think, we can do a lot in terms of supporting and building the political will through the advocacy and campaigning that we do to support WHO and in the kind of consultative process to develop the health data governance framework that we've been speaking about over the last 2 days. And also to push for this resolution at the WHO next year. We already work very closely with governments to position this issue and get this onto their agendas. So this is work that we will continue to do and to support, WHO also in getting the mandate that they need to pursue this issue. We also are very committed to obviously support the process and convening, especially civil society and multi-stakeholders across different regions that we work in, especially Latin America, Asia, and Africa. And also bring in voices of youth, women, and marginalized communities. That's really, really important to us as a global coalition. In terms of alignment with country priorities, so we work across 6 national coalitions that we've set up in 6 priority countries that Transform Health have. So we will continue drive the health data governance agenda across those 6 countries, but also across different regional networks that we work with, such as AHIN, Helena, Rekinsa in the different regions. And then also continue advocating through, you know, what was mentioned earlier, WHO meetings that are happening in the region, but also other processes such as Africa CDC that we have a very close relationship with as well, to position health data governance and drive this agenda forward around a global framework. I think in terms of member states that we work with, I think I've already mentioned a few of them before, but you know, we work very closely with India, Sri Lanka, Philippines, Maldives, Cameroon, Kenya, and many others. So we'd be very happy to continue that work, as I mentioned before, and also to work very closely with DHNI, the DHNI working group and the HTC, and continue working in some of the other global processes that are happening concurrently, such as the G20 Global Initiative on Digital Health and also Africa CDC. I think I already mentioned that. About SCORE, we don't really work to provide technical capacity, so this is not really aligned to our kind of advocacy agenda, but we will, one of the other advocacy agendas that we really push forward is around digital health, investment in digital health transformation. And I think that includes also strengthening health information systems. So we will continue some of that work.
Thank you very much. Now we're going to go back online, this time to the UK, to the Foreign, Commonwealth and Development Office, Desmond Wim, Health Advisor. Desmond, are you online?
Good afternoon, everybody. Yes, I am, and thank you very much for inviting me. It's really hard to know what I can say that will add to the excellent contributions from my colleagues that I've been hearing this afternoon. And I apologize for having missed the earlier parts of the seminar, but some of you I may hopefully have met in countries over the many years I've been working for, well, for a number of institutions, but mostly for DFID and Foreign Commonwealth Development Office as it is now. So what usefully can I say now? I'm painfully aware that I've been talking health system strengthening and harmonization and alignment for many, many years. And we collectively, I think, have made lots and lots of excellent commitments on paper. But then when I visit countries, and I spent most of my working life in countries, most recently DR Congo, and before that Afghanistan, and before that Malawi, and before that South Sudan, I look at our commitments on paper made at boards and seminars and high-level meetings. And then I look at the realities in those countries, and I look at the incredible challenges of our counterparts in ministries of health to orchestrate what is an overwhelming landscape of initiatives and partners and players and funds. And I really do scratch my head, and I wonder if we haven't actually lost ground over the recent years. So I'll try not to sow the seeds of negativity if I'm completely wrong, and actually things are wonderful. But I think we collectively really should take a really long, hard and sharp look at how or if we are actually walking the talk on aligning behind partners and behind partner priorities and systems and processes. And I think I really welcomed the input earlier from Onalenna talking about a single M&E framework, a single results framework. And I think this is where we can really adopt some tangible tools that we can change our practice in countries where it really matters. And I would go further, and I personally think, yes, we need a single M&E framework which will lead us towards the UHC goals and targets if we can possibly get back on track. But I think we also need, and this is echoing, some of you may remember, the 3 ones, which should have been the 4 ones, an earlier AIDS response. we need a single coherent alignment behind a lead authority, and we need a single plan and a single document, if you like, or a score to follow. And the metaphor I often like is that of an orchestra. So we need the conductor, but we are all playing different instruments in that orchestra, but we need to be playing the same tune, and that doesn't always happen, I think. And then the incentives need to follow that. And the fourth one that we often have missed, well, we missed from the 3-1s initiative earlier, was I really think where we possibly can, we should have a single budget. And if those of us can't engage in a single pooled fund or a single budget, we should at least engage in a single spreadsheet so that our financial inputs and support is transparently visible, and we can map where resources are meeting or not meeting demands and needs. Anyway, so just to so I think from the UK perspective, I think we have in the recent years, and I won't go into difficult discussions about reasons and causes and effects, but our bilateral budgets have declined drastically in terms of health support. But our support to global health initiatives have mostly been protected. And so our focus on things like health system strengthening and improving health information systems and harmonizing and aligning our support, we're now taking quite a keen collaborative work with our global health initiative partners to really try and sharpen up how we engage in country. And I know from all of you in the room, this is something that is a key priority for all of us. So I think so much of our support, unfortunately, is tied tightly to specific projects or diseases, and often that drives us to chase short-term bespoke results and indicators, and not necessarily building the foundations of a health system or health information system. And I think we really need to step back and look at this, and because a lot of the data is not necessarily aligned closely to the priorities or the needs of the plans of the country themselves, and the support to collecting that data also may skew capacities and skew time and resources available. And I think for often one missing piece that I see is there's often not a strong focus on HSS indicators itself. And where I would like to just pay some acknowledgement is I think the Global Financing Facility does a really good job here, and their log frame has some great, really very well established, very well aligned, and very much following on from earlier discussions and priorities from WHO seminars that helps us track key goals from our HSS investments. Very, very briefly then to sum up. I think politically and technically the challenges, as Stephen from the Global Fund mentioned, the challenges for orchestrating all this are so sharp and so difficult that I would support. I mean, I'm not sure where we are in terms of our formal engagement, but initiatives such as SCORE and particularly WHO's in-country capacity and competence and presence is so valuable here. And I know that WHO itself is a victim of this fragmentation, and often they have resources and staffing and financing for specific projects and programs and diseases, but not for the broader sweep of health system strengthening, which, it's like building a new building without building the foundations. And yes, you might get something pretty in the short term, but it's all going to fall apart when you turn your back on it. So I think that for me would be sort of the final sort of message I would like to give, in that yes, this is, I think, a really essential focus that we need to keep bringing in without in-country capacity building and the technical and governance lead through colleagues like WHO, and a much stronger commitment to harmonizing and alignment from people like us, we will be struggling. Okay, thank you.
Thank you so much. Right, we're moving straight online to UNICEF. Remy Mwamba, Statistics and Monitoring Specialist. Mweni, are you there? Remy.
Yes. Hi, Samantha. Hi, everyone. So, yes, I would like first to thank the SDG Secretariat for hosting this data event. I also wanted to really thank everyone for the depth of the discussion over the past 2 days, and especially insight from our country colleagues. So based on the conversation that I had this morning and yesterday, I woke up at 4 a.m. because I'm at the East Coast just to follow the conversation. I think we all agree that effective partner collaboration is essential to achieving alignment, first across partners and donors, and also to promoting better data governance practices. And working this way, leveraging our comparative advantage may help us really maximize the impact on the ground. And UNICEF has a huge footprint on the ground. We are present in about 190 countries. And our program cut across multiple sectors, including child protection with birth and death registration. We have the broader health agenda, broader PHC from the community level, and education, nutrition, water and sanitation, and so forth. And also we have some cross-cutting programs such as Digital Health and Information System Unit that support information system and also innovation. And our data function covers most of the SCORE component that Anne presented this morning, including surveys, counting birth and death. We do also support routine information systems at the community and facility level and program review, and we are also enabling subnational data use. And we really believe that the SCORE package is really helpful, since it helps us just to pinpoint what are the gaps in the countries. And what we would like to see is to move a bit forward and to see how we can translate the findings from SCORE to some practical roadmap or kind of improvement plan, cost improvement plan that we can all support. I think we need to move to this direction. And also, we also commit to the principle of alignment, aligning with national plan, policies, strategy framework that outline country long-term goals, and which I think should include also national digital health strategies. And I think that's really important for us as partner to really operationalize digital investment principles, and also to try to align really around supporting national digital health strategies, including digital health roadmaps and digital health deployments. And at UNICEF, we are really now trying to shift from project-based approach to really support, to adopt a system strengthening approach when it comes to digital health. And I want you to reflect a bit on how to attract investment for HIS. I know that Xavier presented, I missed that presentation, it was at 3 a.m. But I know a bit what you presented. But I think what is really important for us is really to demonstrate the value and impact of HIS to support decision-making. As it was said today, including improving the quality of care, patient experience, and so forth. I think this is why really we need to have well-performing health information system that enables evidence-based decision-making. And I really, support what the Secretary is doing by, really helping us to develop this compelling investment case, really to make the case about why we should really support information system. I think beyond what is being done now, we need also to have some country-specific investment case on HIS so that this can help countries, have better conversation and mobilize more fund for that. And yes, we do support, as I said, we have presence in 190 countries, but we have 42 priority countries where we do some active supports. And those countries were selected based on the burden of the disease and also using the population factor and also UNICEF investments in those countries. And also some context ongoing in those countries. And as somebody said, we are not just investing in improving data for data, but we need to support program to understand what are the issues, programmatic issues, and how data can support moving those forward. Thank you very much for this great conversation.
Thank you very much. Now moving back to the room, University of Oslo, Ola Title, STAD, DHIS2 Implementation Coordination. And if you guys could please keep your comments concise like you have been doing, that's great, because we want to leave time for discussion. Thank you. Thank you. Yeah, so I'm from the University of Oslo, there behind the DHIS2 technology. And DHIS2 has been mentioned a lot in the country discussions here over these last 2 days. It's been very interesting to follow and hear from the countries. So the HIS is now used as a routine HIS in more than 70 countries for a broad set of use cases in health and as well as other sectors, and kind of way beyond what it was originally designed for. So I think what's interesting here today is maybe just look at kind of what can we learn from this. And I think when you listen to the countries, I think one thing that is common is that there's a very strong feeling of local ownership when they talk about their DHIS2 national implementations. And that is, of course, a very important step towards sustainable systems. So, and that's not so much about the technology. Of course, the technology works, it's flexible, but I don't think the DHIS technology is unique in any way. What is more unique, I think, is the approach behind it and the approach to support implementations, what we call the HISP approach. And that is very much focused around capacity building, both short-term kind of training courses, but maybe more importantly, long-term capacity building, working with local universities on master's programs on HIS. We have a PhD program that has graduated more than 70 PhDs from the Global South. And you can combine this with a very active kind of community of practice where countries can share with each other experiences, what works, what doesn't work, share innovations. And there's also a network of locally available expertise in the HISP network with the local HISP groups, working very closely with the ministries, not on a project by project basis, but as kind of a lifelong relationship, building capacity within the governments, and making sure that the systems are working. So I think, so what can we transfer to other HIS initiatives? I think it's really the focus on long-term capacity building, strive for local ownership of the technology and the systems. And I really encourage that we can all work together closely with the countries and the governments on longer-term HIS strengthening plans, focusing on capacity building, system design, go beyond this individual short-term kind of donor-funded project, and rather look at this as kind of continuous process of HIS strengthening. Was that cowbell for me, or should I? Yeah, okay. I can stop there. Thank you. Doing brilliantly. Have you finished? Yeah, I can stop there. Excellent. Thank you. Wonderful. Right. UNFPA Online. Ramesh Silva, Technical Specialist, Health and Social Inequalities, and Sainan Zhang, Technical Specialist. You guys online?
Yeah, thanks a lot, Samantha. Can you hear us? Yep,
perfect.
Great. Yeah, UNFPA's engagement with the HDC and SDG3 GAP is really focused in two areas: civil registration and vital statistics, as well as GIS and geospatial data systems. I'll kind of run through the key pieces from the CRVS side, and my colleague Sainan will cover some of the perspectives from our geospatial data work. In terms of comparative advantage and opportunities for alignment, UNFPA now hosts the Center of Excellence for CRVS Systems, a global center which really advances thought leadership and brings technical support on CRVS closer to the field. And this was founded by the Government of Canada and incubated at the IDRC. And I want to really acknowledge and thank the Government of Canada for this support and its leadership on CRVS. Our comparative advantage really is around a life course approach to CRVS from birth to death, including everything in between, particularly marriage and divorce. We see CRVS as a whole of government and whole of society system, and health is a really key piece to that. We take a really strong gender dimension, a gender approach, in terms of trying to understand the gender dimensions towards CRVS system strengthening to make sure that women and girls are actively included. And then also in terms of data use cases around vital statistics in terms of maternal mortality, adolescent birth, pre and postnatal sex selection, child marriage, etc. I want to really stress that we see another big comparative advantage is that we don't look at the health information system and the civil registration system as a standalone. Our strategy and our approach is one of an integrated population data systems strengthening approach. Civil registration, census, geospatial data, health information systems, and surveys altogether. In terms of stepping up and SCORE, warm congratulations to WHO and all the key partners. I think that the update process for SCORE has been really great. We're seeing that there's great integration of some of the advances and newer thinking in terms of CRVS and health information system strengthening. And we see SCORE as a critical diagnostic tool, which helps convene everybody around a common set of basic data. It's excellent. Where we see opportunity for growth, though, is more tools, the need for more tools in terms of implementation science on operations research tools to help us understand what works, where, when, and how, and what's scalable in different contexts with regard to CRVS and health information system strengthening. And this is a priority area for the Center of Excellence at UNFPA. In terms of priority countries, similar to our good friends and colleagues at UNICEF, we have a global footprint of 150 program countries, serviced through 135 country offices and 6 regional offices. Our alignment is really close in terms of CRVS and health information systems, really closely aligned with the timing of the 2020 census round. And then further, the Center of Excellence itself was founded by the Government of Canada to particularly align some of the CRVS system strengthening work with GFF investment cases. And we continue that prioritization.
Sorry.
And then lastly, if I could just conclude by highlighting that the other piece which shapes our prioritization is really around the timing of voluntary national review countries. We see a great opportunity through the VNR process for greater use of CRVS and geospatial data in SDG monitoring and measurement.
Wonderful, thank you. Maybe Ramesh, if Ramesh is going to comment. We've had a lot of comments from the room that neither the multinational agencies nor the donors are really aligning with what countries really need. So maybe you could say what you plan to do differently, because we've now heard the great stuff you're doing, but maybe how you're going to do it differently to move forward. Thank you.
Great. Did you also want to hear from our colleague Sainan on the geospatial pieces as well?
Just on how you're going to align, because we're running out of time. So maybe you can, in terms of what we've just heard in the room, how you, at UNFPA are going to try and adapt or move with what the countries want. Thank you.
Yeah, thanks a lot. I think, the SCORE assessment tool and the joint country missions we see as really, really valuable. In terms of highlighting what does country need look like and what needs more technical support, more investment. And so the joint nature of HDC and SDG3 GAP coordinated technical assistance we see as a real value add. Where we see for things that we could do a bit differently is I think, from our perspective at UNFPA, we've been really engaged in the CRVS technical working group and in the Data and Digital Accelerator on SDG3 GAP. These have been excellent. Where we see opportunity for better alignment and how to work a bit differently is we'd love to see more collaboration across the accelerators of SDG3 GAP and across the working groups of HDC. We see great potential, particularly to work with the data governance experts and also colleagues who are really supporting universal healthcare and to align these pieces in terms of big investments on permanent data systems like CRES and geospatial data.
Thank you much. Thank you very much. So are we now moving on to CDC? Thank you. And then the World Bank, and then we're going to move to the discussion. Yeah. So we have some time.
Thank you, Sam. I will not repeat what I've said earlier about the CDC work. I did want to just say a minute about some of the priority areas for CDC include disease surveillance, laboratory systems and infrastructure strengthening, emergency response, and workforce improvement, including in use of data and planning for and strategizing for systems. Some specific areas under the DMI work, the data modernization work that we are targeting for improvements through our infrastructural improvements include mortality surveillance, civil registration and vital statistics, global antimicrobial resistance surveillance, molecular epidemiology, including genetic sequencing, support for One Health surveillance and cross-border health and refugee information systems, vaccine preventable diseases, immunization registries, and respiratory disease surveillance. The only other comment that I wanted to make along the lines of better alignment and SCORE, I, like my earlier colleague, think that some additional granularity could be useful, particularly for measuring investments in digital technology, including how those are actually, how the work is actually progressing, ultimately leading to improvements in data quality that you should see reflected in SCORE. But the process of measuring technological improvements like interoperability, health information exchange, standardization, and cybersecurity, for example, that isn't currently, and I think there's more work to do there to improve some of the ways we measure that. Thank you.
Thank you, World Bank.
Thank you. I also spoke previously, so I want to repeat our whole approach at the bank about how we are moving towards a more digital and health approach. Again, what that means is taking a more intentional approach to embed digital and data in our health system transformation projects. So we already have a huge portfolio of health projects. So we're looking at, okay, how do you bring digital and data more systematically and intentionally into these projects? So I don't want to list out specific focus areas because it's going to be informed, A, by country demand and country priority. I think we're very clear about that. And again, second, it depends on the health system project, the problem you're trying to solve within that holistic health project. And so as a first step, we are conducting an assessment of our own portfolio as to see where we've invested in these different digital aspects in our portfolio. We want to understand better our own investments. We want to see what's the trend be, what is the trend being, what are the blind spots where we should be investing in the future to better inform our systematic thinking and support to countries. We're also coming up with different products that can help our own task teams who are in frontline helping countries in terms of understanding this huge space. Even simple things like, I mean, it's not simple. What I mean is for people who are not very familiar with the topic, like implementation of digital health records. What does it entail? What are the differences between different types of digital health records? What does it mean when we talk about cybersecurity and health? Basically, we're trying to move away from this idea of talking about the importance of digital health into actually doing it in a scaled up manner and really unpacking and thinking about what does it mean practically. I just want to say that in terms of signal as to why this is really an important agenda for the World Bank, I've talked about the report, the World Development Report on data. So data governance in general is a really important agenda for us, and we're seeing how to bring that thinking into our investments. Our focus in countries is, again, low and middle income countries, about 74, 75, kind of changes a bit. So our focus is, we work in all countries globally, but our focus is primarily low and middle income countries. And again, we stand by to offer support through our financing, analytical work, technical assistance, and capacity building. Again, another quick reference to the Joint Learning Network. If anybody's interested, we've been starting to conduct courses on digital health, specifically on different areas under digital health. I'm just raising this because I know this, the countries presented training and knowledge sharing as another important aspect of what is needed by them. Thank you.
Thank you very much. And it looks like we have a short comment from, again, from UNFPA, from Sainan Zhang. Please go ahead.
Okay, thanks. So I just add a little bit on the geospatial side of our work. And so UNFPA realized the importance of the geospatial data and the technology in the SDG3. So we focus on the support the use cases to help data, help countries to strengthen their capacity on the use cases of integrating population with health facility data to understand the people's coverage and access to all kinds of health services. And to achieve this goal, we're partnering with WHO and UNICEF through SDG3 GAP. And to build all these use cases around the data needed. So we are helping government to strengthen the overall geospatial data system, including the population data, health data, and survey data, HIS2 data, as well as the core geospatial data like road system or the boundary data, and etc. So we hope that these collaborations can make a difference, and we are rolling out like from the pilot countries like Nepal and Malawi, and now we're engaging more countries. We hope donors can realize the importance of this piece of work and support this collaboration. By this way, we can contribute to HDC, and also we have the GIS working group to work on all these geospatial areas. Thanks.
Thank you very much. Right, so last word goes to the countries. Any comments, questions, and then we'll move to the concluding remarks. Des commentaires finales? Great, thank you.
Thank you. My friend from Global Fund is not here. My comment is for Global Fund. Shall I start or shall I?
Yes, go ahead. Don't know where he's gone. Oh, he's at the back.
I would like to appreciate the contribution being made by Global Fund over the last 20 years in Pakistan for AIDS, TB, and malaria treatment and diagnosis. As a layman question comment that Global Fund is supporting separately for AIDS, TB, malaria, MIS. For example, there are 3 PRs in HIV. They'll be fulfilling dashboards independently, separately, and the data is never being compiled on HIV by all the 3 PRs. If you go to see the data collection places, that is RHC or a DSQ or a DSQ, there would be 3 data persons, one working by the support of HIV grant. She has nothing to do with the data collection and data issues with malaria or TB. So if we see the investment being made on MIS by Global Fund over the last 20 years, and we calculate the volume of funds, we would be seeing that we would have established a huge country level HMIS in Pakistan. I would appreciate if Global Fund could consider, one of the grant was probably health system strengthening that really worked for MIS, HIS in Pakistan with the Ministry of Health. But that ended and there is no sign symptom that what we have invested and what we have gained. So would you please consider to have an integrated system of information collection somewhere by Global Fund, please?
Thank you very much. I think that's noted. Any other comments from countries in here hiding, being shy? Any other comments from anyone else before we wrap up? Yep, go ahead.
Yes, thank you. Just I think this session was a bit shocking. I think that the rhetoric from donors and partners is actually the same of the last 5 or 10 years. I think this really confirms this disconnect between donors and countries, particularly with all the issues that we have been raising from the country perspective, but also from papers and research. I think that it may be useful maybe that donors have some reflection on what has gone wrong and what has to be changed, because repeating the same thing 1 year after the other is not going to bring us very far.
Thank you. Well, I think there's quite a few people listening online, so hopefully something will move on that front. What else? Any other comments? Last chance. Oh, good. We get last words to, okay, and then Anne and South Sudan.
Yeah, well, I just want to just say that I think we have spoken, and Botswana clearly summarized what we said. And the countries are saying that our partners, our donors, the multinationals, the civil society, all support our one plan, where we have put in place our health information system improvement plans or strategic plans or policies. Let's all align behind that. Let's all translate these commitments that we're making at the global level to reality on the ground in countries. Let's see that this collaboration and these commitments you're making here is what is actually done on the ground in countries. I just wanted to summarize it that way. Thank you.
Yes, maybe pass the mic to your colleague. Thank you.
Yeah, thank you once again. I just want to make a comment from what I was hearing as we were listening to the donor representatives and the Global Health Initiative partners. I must say, this has provided an excellent opportunity for us to at least get direct audience. I want to emphasize again that effective engagement and communication between the countries and the donor groups is very, very, very important, because what is happening earlier, I mean, what is happening at the country level, which we have talked about since yesterday, makes it necessary, you know, to at least have a forum or an opportunity that can bring together, you know, even if once in a year or once in a while, to have this conversation. I can give an example of a situation whereby I often get surprising messages when they are delivered through a third party that mostly happens to be, you know, the implementing agencies, you know, and that reflects some confusion, and it is important for us, so speaking to the donors directly, you know, this middle party communication does not really help us. I tend to remind our people back home, you know, at times when we are stressed, that even when we go back to the history and we'll follow the religions, those days when God used to have messages sent to us through the prophets, that era, even God himself had to phase them out and decide to be talking to people directly. You know, that's really very, very, very important. So I would really appreciate and encourage the donors to have this opportunity. Listening to some of the donors who speak, or donor agencies speak online, I could see if the colleague from FCDO, Desmond, we have interacted. He was in South Sudan, as he said, and I was very impressed from what he was saying today. I really wish he could even be brought back to South Sudan. I believe things would be completely different, you know. So I could also say that the donors are also learning, you know, And the learning could also be more effective if we listen to each other, if we talk to each other. To conclude, I'm happy that the Global Fund colleague is here. You know, there are other opportunities that are also being funded through the catalytic funding, which we have recently as a country tried to catch up with, although it's actually late hours. The Persuade project, which is also trying to support countries to strengthen capacity on data analytics and data use. So if opportunities could also be encouraged to also pick on countries that are really in a dire need to build this national capacity in terms of data governance and HMIS investment. Thank you.
Thank you very much. So we have another fantastic quote here. The prophets and the middlemen need to be phased out, and it needs to be direct listening and communication between government and countries. And I think we've heard that very loud and clear. And obviously we all know that donors and multilaterals have long budgets, long planning, but hopefully this meeting will stimulate some changes, and you have to keep at it. Very good. All right.
1 minute.
Yes, go ahead.
Just, we have listened a lot to the discussion and has been focused. I think one common theme here is that we all put country at first, and we all want to strengthen the data systems in the country. We have agreements on how donors work together, and I think the next step is to do that at the country level. And I've seen it, and if we do it well, it works. We have provided the framework for the health information systems, where different components of it, how it interlinked and how it worked together. It's not a silo, how it worked together as part of the bigger data ecosystems to help, number one, to plan and for the country at higher level to monitor the SDGs and USC. But more importantly is for the management of the health service and later on. And we need to strengthen the routine data system if we want to do a more subnational data use and slowly to improve data quality. So one ask back to the country is we all agree that we have one common plan. We needed one vision, one common plan, one ME framework, and ideally it should be a one budget or one sort of share budget, and where we can put all the different contribution into one place. So what we need is a strengthen the data governance, the coordination, the leadership. And the ask to the countries, what would you need to let us know how they're going to support you to empower that. It's very difficult when you have lots of donors with different priorities to come in and have the budget together with the requests. How do you balance that, and how we could, trying to see how we can empower the government in terms of the leadership so that you can take the lead in strengthen the country systems in ASTO.
Thank you. That's an absolutely perfect way to wrap up the session. And now we're going to move to the summary and the next steps with Tashi Chozom and Mwenya Kazondo from the HDC Secretariat. Thank you.
Hello. So we really have come to the end of our event. It's been quite a ride, I would say. Very, very good, rich, honest, open discussions. And we have different entities. We had yesterday different entities, and still today different entities are representing various countries, partners, multilateral organizations, bilateral organizations, civil society, the private sector, research, academia, technical networks. And our conversations kept us grounded, I would say, cognizant of the realities in the countries. A lot of issues emerged. For instance, if I mention a few issues that were mentioned by most countries and partners as well, for instance, poor health information system infrastructure. Togo mentioned about internet connectivity issues in most parts of the country. And we're talking about scaling up digital solutions. Low capacity in terms of data use. Zambia talked about, in addition to the data challenges, data collection challenges faced by the country, data use is another prominent challenge that they face. Ethiopia stressed on fragmented HIS. That is further compounded by fragmented investment by partners, often imposing various data collection frameworks and tools that ultimately impacts the health workers who are responsible for collecting these data in the health facilities. Many countries talked about data access and availability issues. For instance, David from the Euro WHO Office for the European region talked about how SDG3 is doing well in terms of, compared to the other goals, in terms of data availability. But when you really go down, when you really dissect it at the subnational levels, these are real issues that are faced by the countries. But one thing that many pointed out is that these are the same issues. We have been talking about these issues for a long time. And as Claire in the morning said, we will continue to talk about these issues. And Xavier at the very end said, the rhetoric remains the same. We'll be talking about these issues year in, year out. So what is wrong? One thing that really emerged from all the discussion is, what is really wrong with the current approach? Where are we going wrong? So that is something that most of us had the opportunity to think about during this event. And against this backdrop, just highlighting some issues that emerged during the discussions. So many countries and many talks talked about sustainability, that interventions, solutions in the countries need to be sustainable. Sustainability has to be at the core of HIS efforts, not project-based. And even Remy pointed out, it's reassuring to hear that organizations like UNICEF, Remy spoke a bit earlier today, and he said that they're moving away from the project-based approach, moving towards system strengthening, and that is reassuring to hear. And in line with the sustainability issue, moving on to the second point that is tied with sustainability, many of you talked about strengthening national data systems, technical capacity, and regulatory frameworks. For instance, when you strengthen technical capacity, mostly in terms of data use, so that countries are equipped with the skills to develop solutions that really serve their need. And the third point that really emerged was the multi-sectoral approaches. Many countries talked about the various multi-sectoral approaches that they have adopted in the countries, but it is not enough. And also, when we are talking about HIS systems, we acknowledged in our discussions that there are many moving parts. It's a big and a complex ecosystem. For example, if you talk about entities in the countries, internet connectivity, we are talking about the telecommunication sector. If we are talking about investing in HIS, we are talking about the finance sector. So acknowledging all these different moving parts in a system, finding ways to work together so that health information system is better financed, so that the infrastructure issues are addressed in the country. So that was one thing that really emerged. And talking about SCORE, many pinpointed that the SCORE as a tool has been useful, for instance, to point out where the HIS gaps are in the countries, and also really looking at SCORE as a way to generate both political and financial resources for the countries. And lastly, one thing that emerged as well was that this is the time that there is a very huge political momentum at various levels in the UN organizations talking about data governance, and also in the countries really calling for good regulatory frameworks. And Steve mentioned yesterday that use of data, and again, reuse of data or in a safe and secure environment. So now is the time that, and everybody has been saying that to truly make an impact, to truly improve our data systems, data collection, data use in a safe, secure environment. And sorry, the slide changed. And finally, the one message that everybody was talking about repeatedly was the need for effective partner coordination mechanisms. And there were several examples that were given, that countries need to be at the driver's seat, and if it's orchestra, the countries need to be the conductor. But if countries are the drivers, then partners are in the same car as passengers, then HDC is a unique platform or a unique collaborative at the global level with over 200 organizations, 900 members. So HDC in a way can be seen like the bus, with the countries driving it, with all the partners in the same bus, moving towards a journey, getting to a destination where we all want to go together. So these are some of the messages that really emerged. Thank you. And I'll pass it on to Enya.
Thank you, Tashi. And thank you so much for everybody who's joined us here in person and online. It's really been a wonderful 2 days. We've had some very, very rich discussions. We've had the discussions and now it's time for action. And this is really where the challenge is, and this is where the real work begins. South Sudan has encouraged us to meet again, and I hope that the next time we meet, we'll be reporting on what we have done collectively as partners, and the conversation will move forward slightly. There are certain things that we can do here as Secretariat of the HDC, but of course, much of the work lies amongst you here all as partners, and the majority of the work lies in the country, on the ground. And we rely on you as country colleagues, as governments, to lead us as we embark on this journey to continue to support health information system strengthening in country. So 1 or 2 specific action points that we pointed out from the last 2 days' discussion. The first, of course, we have reinforced the need for one plan, one M&E framework led by government. Tashi mentioned that the HDC is a very unique platform. We currently boast roughly 200 organizations represented and about 900 individual members. And of course, the breadth of technical expertise that lies within this organization or within this collaborative really needs to be leveraged upon. So I encourage our country colleagues to again use the HDC as a vessel to achieve many of their goals. We've also been encouraged to develop a data governance framework, and I would argue whether we need to add the health to that sentence there. But again, this framework needs to be underpinned by trust and equity. We need to be as specific as possible, but this is something that will take us through 2023 and 2024. We've spoken much about investing in health information system capacity building. And I think this reflects some of the words that we heard throughout the last 2 days about the importance of looking at health information systems as part of a broader ecosystem. Investing in health information systems will require investing in human resources for health. It will also require investing in digital infrastructure, especially in rural areas. We've also spoken about alignment, and here again, we call on partners to align with country planning and budget cycles. Somebody reminded us today that if we cannot at least align on an Excel sheet, how are we going to do it in practice? We've had some very specific requests from our country colleagues here, specifically in the area of GIS. I think GIS is really emerging more and more as a very exciting tool in which we can achieve many of our objectives. I'm glad that Ravi and Simon are here. We also had a colleague from UNICEF join us on some of the country missions that we undertook recently. We've mentioned Malawi and Nepal. Again, supporting GIS system strengthening as a tool that can support further health information systems. South Sudan has made this request, Togo has made this request, and Cameroon has also made this request. And we look forward to receiving this request formally on paper so that we can see how partners can come and align behind this. And lastly, we continue to support in-country health data collaborative platforms. We look to our colleagues, especially in Botswana, Cameroon, Kenya, and other countries who have very, very strong established country platforms as health data collaborative platforms in country, again, led by the government. And we really see this as an opportunity today to continue to foster these platforms in different countries represented here and otherwise. And I'll pass it now to Craig to wrap up.
Thanks, Tashi, and thanks, Mwenya. This is the last slide. Before I start, I just want to kind of say I'm going to hand over to our two co-chairs of the HTC, Steve McFeely and Onalenna, who are here with us just to have the closing remarks. But before I do, I just want to reassure you in terms of next steps. I think I've highlighted this slide before earlier, but very concretely, we want to get the report out to you of this event within the next month. We're hoping for 2 weeks, but probably the next month. It'll probably be after a lot of dialogues with member states during the World Health Assembly. And as that slide said earlier, we really want to move forward over the next 2 years with a country focus, with a group of countries that are part of the HTC possibly and part of the GAP process to really work with you countries using SCORE as a possible framework, as an investment framework, and really looking at the timing that's aligned with country budget and planning cycles already as a group, as a partnership. And I want to again mention this collaborative is your collaborative. We are the Secretariat, but it's your collaborative. Use it as you want to. I mentioned capacity building before. We mentioned the follow-up with communications and advocacy. We'll be working very closely with many of you as part of that, both for bringing the health information systems, strengthening investments, and the data governance advocacy that's required. That's been mentioned together with key messaging at high-level events this year. And then making the case with others. There's a fair amount of work to be done to make that social and economic investment case for health information systems and data governance as well. So we'll be following up. Everyone has access to the link online. There'll be a recording of the event as well. So I want to really finish off by thanking our facilitator, Samantha, who's done a fantastic role. Many people might not know this, but she stepped into the role, I think, 4 or 5 days ago, unexpectedly. So she's done a fantastic job at the last minute, and a huge thank you for getting up to speed very quickly and facilitating us all and keep us on track. I want to thank also our team here, the Secretariat team, which includes Carolina. Would you like to stand up? I think everyone has been in touch with Carolina. He said everyone fears Carolina's emails because she's so efficient, and she is fantastic efficiently to work with. So thank you, Carolina. Thank you, of course, Tashi and Mwenya as well, who've helped behind the scenes as part of the Secretariat. Thank you to the team here. And most of all, thank you for coming up to getting here. There's one other person I want to thank. I don't know if she's in the room, who got you here. And actually Nina, who's been doing a lot of your administration, a lot of your behind the scenes budgeting. So Nina, don't be... And thanks to everyone who joined online, who provided comments. There's a huge amount of inputs. So make that available in the report as well to make sure that reflects it. And as I understand, there is about between 150 and 200 participants in any one session. So really good online participation. We hope the next call might not be in Geneva or New York or anywhere. We would really, as you heard from many partners, for visa issues, but also because it's more closer to the countries we would like to invite. We'll be talking about which regions can possibly host the next meeting as we build up this momentum. So with that, thanks to everyone. And I'm going to pass over to our co-chairs of the HTC, Steve McFeely and Onalenna as well. So Onalenna and Steve, I wonder whether you wanted to help conclude the proceedings if you can.
Okay, thank you very much. Colleagues, I think it has been a wonderful 2 days that we have really learned a lot. We have shared a lot, and it was really good to be with you these 2 days. I just want to emphasize that we have heard from our partners. They have made several pledges to us. But I want to go back to what one of our partners said earlier on, that as we point a finger at the partners, let us remember that the 4 fingers are pointing at us. So I just want us to challenge us to really take responsibility, be on that driving seat, control your destiny, and the partners will just come on board. So thank you very much, and we hope to meet again.
Okay, very quickly, it's Friday afternoon, you're tired, you want to go home, you want to have a drink. So on behalf of the WHO, on behalf of the HDC, just thanks to everybody for coming. In particular, I think thanks to those who persevered online. People who got up at 4 in the morning or stayed up until midnight. I think that we don't see them here, but as It's a real challenge to do that. So really sincere thanks to them. And thanks to everybody for the frank exchanges. I think we heard a lot of good stuff. I don't think anybody held back. So a couple of things I want to reflect on, because these are messages for WHO as much as everybody else. The alignment of digital and data came out time and time again. I think that's something we really need to reflect on in WHO and maybe others too. And really the imperative importance now of digital and data governance. I think we've heard that time and time again over the last 2 days. The other thing that a number of people mentioned, which I really liked, was the getting back to basics, sorting out fundamentals. I think we all love to come into a country and start building the house on the second floor and then build up. And we typically ignore the foundations. So like any house, it needs a sewage system, but nobody wants to talk about it. They want to talk about the pretty windows, the nice lattice around the door. But any building, it needs foundations, it needs sewage, it needs piping, and that's the piece that we continually ignore. HIS is comprised of many, many data sources, as we've discussed, and none of them are more important than the other. So it's not that surveys are more important than administrative data or big data. They all have to function together, and that's really critical. The gratifying news for us, I think, is we heard that SCORE has the potential to be a tool for alignment that we can all work around, and that's something we'd like to encourage everybody now as we prepare for the next SCORE assessment to get feedback from you. We really want feedback on what worked the last time, what didn't work, so that it becomes a tool that's useful for everybody. Not everything can be solved by technology, so we need to develop capacity in countries. We heard this again, time and time again. Country ownership, we heard loud and clear, but I would say to my colleague in South Sudan, country ownership of the agenda, not necessarily of the data. I'm not sure I agree with that. So we can have a discussion about that over a drink. So when we come to the end of 2 days, like good doctors, we've diagnosed the ailment. We've identified many possible remedies. Now the question is, as patients, are we willing to take the medicine? Are we willing to change our behavior? Are we willing to take medicine that maybe isn't so palatable? That's really the question. And it's to all of us. It's to the multilaterals, it's to the donors, it's to the NGOs, it's to the countries. I think we all need to look at what we're doing together. So with that, I'd just like to reiterate my thanks to Craig's team. It's like any good meeting, there's a lot of hidden stress in the days leading up to it that you shouldn't see, and we don't want you to see. We want you to think this was seamless, but it wasn't. There's always little dramas. So thanks to everybody. And on behalf of myself and Onalenna, as the co-chairs of the HDC, just thank you so much for coming, and I wish you a safe journey home. Thank you.